Hi, I'm Megan Norman. I'm a Minneapolis newborn and family photographer, a mom of three, and I know firsthand how overwhelming the internet gets at 2 a.m. when you're a mom and you just need a straight answer. That's why I created Made for Minnesota Moms, real conversations with Minnesota women who support pregnancy, birth, motherhood with resources you can actually use. Today's guest is Sarah Glesmann, owner of Sakura Pelvic Health and a pelvic health physical therapist who helps women navigate pelvic pain, pregnancy, postpartum recovery, and bladder and bowel concerns so you can get back to the activities they love and feel at home in their bodies again. Sarah, welcome. Thank you so much for being on the podcast. I'm super excited. And before we hit record, you also said that you also treat men and kids. I thought that was really interesting because I never really thought about pelvic health. Everyone has a pelvis, and I really only thought about women. For people who don't know what exactly a pelvic floor physical therapist is, can you kind of talk about that to start?
Sure. So thank you, Megan, for having me on here. I'm excited to share a bit about pelvic health physical therapy because I feel like not everyone has a deep understanding of how we can help serve our communities. So pelvic health physical therapy is a specialty of physical therapy that focuses on all the various systems that can affect the pelvis. So the pelvis, is a small area in our body that has a lot going on. So our bladder is in our pelvis, our bowels in our pelvis, our uterus is in our pelvis, our hips are in our pelvis, our spine is in our pelvis. And so all of these systems can interrelate and play on each other. And so it can be simple sometimes, and it can be complicated sometimes. So we like to use the word pelvic health because it's more than just the pelvic floor. It can be like the abdominals, it can be your hips, it can be your spine. So it's kind of taking a little bit more of a broader lens. And so, everyone has a pelvis. So kids have one, men have one, women have one. We even treat people who go through the gender transition. So it's a broad, everyone basically can benefit from it, but I don't think people realize, that kids can receive, and when kids receive pelvic floor physical therapy, it's not invasive, it's very kid friendly and appropriate.
Once I heard about pelvic floor health and how much women can benefit from it and what you do. I've heard many success stories, but I will say I have 3 kids and I don't even remember anyone ever talking about it or explaining how important it was just to even get assessed after you have a baby. And one of my friends was telling me that pelvic floor therapists are very busy because it's being more and more talked about. And it doesn't sound like there's a lot of pelvic floor therapists. Is that true?
Yeah, it's definitely a newer, when I went to PT school and graduated in 2000 and worked in an orthopedic clinic. And in 2004, my boss came to me and said, Sarah, I really want someone in our clinic to specialize in pelvic health. Will you go get that training? And I just about died. I wanted to cry. I did not want to do it. All I could think about was peeing and pooping has nothing to do with physical therapy in my brain at that time because it was not a thing. It was not a thing.
Yeah.
And so I was a new little PT. So little obedient me was like, okay, I'll go take this class. But if I don't like it, I don't want to do it. And she was like, fair enough. So I went to the class and it was a very broad class and it was for orthopedic issues. While I was at this class, it was all these light bulbs went off. All these patients just started flowing through my brain. And I thought, oh my gosh, that's why she didn't get better. Oh my gosh, I bet that's what she was dealing with. It opened an entire world to me. And then I got really interested in it and loved it and then went down the path. But that was in 2005 and it was at its infancy. And now we're, 20 years out and it's definitely more mainstream. So I'm super happy about that.
Yeah.
And there's now an explosion of clinicians doing research on women, finally. So we're getting information and accurate information about how pelvic health can impact pregnancy and postpartum. And we just like forever, we told women all of these things that were not evidence-based, like,
Yeah.
and it was just like anecdotal. And so now it's like really encouraging to see there's an explosion of research on how if you're an active mom, there's no reason why you should stop doing all those things in pregnancy. Like
Right.
stay active, stay healthy, do it, and like the benefits outweigh the risks. Of course, everyone's different and, you have to take that in with a grain of salt, but women should be encouraged to be active when they're pregnant.
Yes.
Yeah.
I feel with my first, and I guess I think naturally with kids, I got more active. And by the third, I felt like he was my best. And I'm sure it's just because we were going, but I also was eating better and doing more exercise. And it really did make a difference. So I'm glad you mentioned that because I think, like you said, so often it was like, oh, I'm pregnant. I probably shouldn't do this. But I think that talking to your, different providers, I think you'd find that most would say that you should continue to be active because it only helps.
Yes. And there's evidence coming out now that women who are active have better labor because labor is an endurance event,
Yes.
so if women have kind of trained their body in a way, like they're used to exercise, they're used to kind of endurance type activities, then they're probably going to have an easier time delivering the baby and an easier time recovering postpartum. And that's really important,
That makes a lot of sense. I never asked you, how did Sakura come to be? Because you said that when you got your certification, you had a boss. Now you have your own clinic. So yeah, how did that happen?
Yes, I worked in clinics for my entire career. And my husband recently got a job here in Minnesota at McAllister. He's a basketball coach. And so we moved here this past summer. And I'd always had the desire to have my own clinic and dream, but just kind of wasn't working out with my husband's career. And then I lived in New York City for a long time, and so I couldn't even fathom having my own clinic in New York City. It's like, I could never afford that. So when we moved to Minnesota, I just got inspired by other PTs that were going out on their own and decided to give it a shot. And so I opened my clinic, and it's in St. Paul on Grand Avenue, kind of near Fairview. And it's a small clinic. It's just me in there. And it's great because there's no distraction. I can like really focus on each person who comes in. They can kind of say whatever they need to say because there's no one listening. And I've really prioritized spending time with clients. So I spend an hour and a half for the initial assessment. And then my follow-up visits are an hour. It's great because, it can be complicated, and I like to take a whole body approach. I like to hear from women, what has your life been like? Have you had any injuries? Have you had any surgeries? And really be able to put all of that in perspective so that when I'm looking at this client, I can see them as a whole person and kind of, looking at their sleep, looking at their nutrition. I know you had naturopath on here. Is that right?
Yeah, we've had Dr. Britt, which is a naturopath, and Hannah, who is a functional health practitioner. Yeah. And
Right.
exactly what you're saying. You all emulate each other. It's crazy on the full body, how important your story is and how important it is to assess you as a whole person and not just the things that are happening. So it's fun to hear you all say this naturally when you answer questions because, I have found it to be such a great approach because everything, like you said, is interconnected. And by getting to know your patients, one, I'm sure you just create this amazing relationship with them and it's built on trust. But two, you really can get in there and understand what has been happening and why it has been happening.
Yeah. And like, I really want to know what their goals are. Like, what do they want to be able to achieve? And then getting that vision in my mind and then working toward that. And so I think the health industry has changed over the years. And so they're shortening all the treatment times with clients, right? And so it's getting harder and harder to be able to provide quality care, quite honestly. And so I
Agreed.
love providing quality care and I love staying up to date. And one of my main hobbies, like I love to exercise and I love to listen to pelvic health podcasts when I'm exercising. And so I'm learning every day from people all over the world and just trying to provide the best care for my clients. When you look at like new moms, for example, or let's back up to like you find out you're pregnant. There's so much a pelvic health physical therapist can do to support a woman going through pregnancy. I mean, even if it's just a check-in, like a one-time check-in, and this is if they're feeling okay. You know, if a woman's like really sick in pregnancy and doesn't feel well, you know, we want to encourage movement, but we want to encourage movement in a way that feels
Feels good.
capable, right? But it's supporting these women and helping them, empower them. Like, what positions can they get into when they're in labor to facilitate opening of their pelvis so that the baby can come through, you know?
So is that stuff that you talk to with moms when they come in to see you for the first time? That's something that you talk about? Because that's so smart. I never thought about that.
Yeah. So if a pregnant woman comes in, probably the most common reason pregnant women come in are because they're having pain, pelvic girdle pain. That's like a major issue in pregnancy for some women. And so then it's like kind of getting them back to a place where they feel good. And then once they feel good, it's then educating them about like, here are some positions you can get into in labor. If this doesn't feel good, go into this position. And just empowering them with like teaching them to feel their own body and giving them the experience of what it feels like to be in different positions. And then
So smart.
giving them that tool, right? Because it's not a prescription. I can't say, oh, you need to be in this position. You need to do this. It's like you want to give them options, but ultimately they have to connect with their own body and feel what feels right to them. So
That's so smart though, because you don't know. You have no idea unless someone shows you to really understand what are the different positions. So that has to be super helpful because I just think about like the quote unquote normal position you are in when you give birth, but it sounds like there's many different positions that you can get into and that to hopefully feel more comfortable. That's so cool. Okay,
yeah.
so
And then it's also important. And I think sometimes, I think a lot of the times we don't know what we don't know, right?
yes. Yeah.
So we just don't know. And unless someone kind of opens that door for you, and then you're like, oh, okay. So it's providing a lot of education. And then it's also providing education for after you delivered the baby, what symptoms are normal, because there's a lot of symptoms. Having leakage right after you delivered a baby is pretty typical. But it
Yes,
should
but
go
yes,
away after a
exactly.
certain point.
Yes.
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 And
We just
so,
normalize it. Like, oh,
right.
That's just what happens after you have a baby. No, it's not. There is
Correct.
someone who can help you so that doesn't happen and you can feel comfortable and confident again.
Yes. And I think so many women have just heard our poor moms who got no care. Like they've heard them say, oh, I just leak and that's just how it is after you have a baby. And
Yeah.
it's like, it doesn't have to be that way. There are
No.
so many things we can do to help women feel good and not have to live with a lot of these side effects that happen. That's the thing I think, I hope it's changing, but pregnancy in and of itself is a big transformation in the body.
Yeah.
And then you go through labor and that's another big transformation. And so there are women who go through both of those and are fine. But I worry about the women who go through that and feel fine and, soon after they've delivered. But when they get to be in their 40s and 50s in like the perimenopause phase, things start to go sideways, and they're like,
Yeah.
what's going on? What's happening to my body? And oftentimes it's because they never reconnected with a lot of, like they never reconnected with their pelvic floor after giving birth, or they never reconnected with their abdominals after giving birth. And so they've just kind of been able to power through, but it eventually will show itself. In an ideal world, a woman would see a pelvic health therapist while they're pregnant.
Okay.
For maybe a visit or two, just to get some education. And then they would come in after they've given birth at certain points. So maybe like a 6 to 8 week
Okay.
checkup. And then again, maybe 3 to 4 months if they're not having any symptoms, and just kind of checking in, because it takes about a year for your body to recover from
It's
pregnancy.
yes, it's a big change. And I think that more of us need to give ourselves grace. As much as it's easy for me to say that because I'm outside of that now. But like Hannah talked about, we're in this bounce back culture where we, like, yes, we want our bodies back, and I get that. But like, we also need to nurture our bodies, take care of them, and because we've gone through this big change. And so to see someone who just can give you different exercises or tips on what you can be doing so that you can start to feel at least a little more like yourself. I went to see a pelvic floor therapist like 2 years ago, and it was really interesting to see kind of how she moves through the appointment and what she's checking and things that I never even thought about, like what you're talking about, like with deep core work, like understanding where your muscles are and how to fire them, and just doing some simple exercises and realizing, oh, yeah, I haven't been firing those muscles, or this is how to do it. I found it really interesting.
And like, I'm just thinking about this one client that I'm seeing right now, and she's a big runner and she wants to get back to running. She's in the postpartum period. And right now I'm working with her and she's not leaking, but the more we kind of talk about things, I'm hearing her say things like, oh yeah, after I go for a long run, I have to rush to the bathroom because I don't feel like I have any control. And so that's like a great gateway. Like, okay, so your pelvic floor muscles fatigue when you're running, And so what can we do to be restorative after you've gone running? So I've given her a tip, like, why don't you lie down on the floor and put your legs up the wall, put a little pillow under your bum, and let gravity bring those pelvic floor muscles more towards your belly and let them rest and let them recover. And it will help you moving forward, So it's like providing these little kind of tips and tricks that, most people don't think about.
But that are easy and they're easy, and you can just do them really quickly. Because I think a lot of times too, we think we're going to get this laundry list of things, or we're going to feel guilt tripped into doing things. And I don't think it is. I think it definitely, what you're explaining is you take the time to really explain to them why they're doing this and what the rewards will be by doing them. And they're not some like laundry list of things. It's very small changes that they can make.
Yes, because like no new mom wants a lot. They already have their laundry list. So yes, I love to try and like weave in these things into their day. Like, let's think about doing this when you're breastfeeding or something like that, just to kind of give women that support. Yeah, it's really fun, especially in the pregnancy and postpartum space. There's so much room for recovery. But pelvic health, we can work with kids as well. So I'm seeing a little guy right now who's gone through potty training, and he still is leaking during the day, and his mom doesn't know why. And we're diving into that, and in his particular case, he's got constipation. And so constipation the pressure from the bowel can push on his little bladder, and he doesn't feel it. And he just leaks, and he doesn't know why. And so it's not a behavioral issue. It's more complicated than that. And so it's slowing down enough to be like, okay, let's create a safe space for him to go to the bathroom where he feels like there's not a lot of stimulation, where it's quiet, where he can actually tune in to his body. There's such a variety of people we can serve. And
I never really thought about that for kids. I always just think about women, but it's so nice to have that resource. Plus, exactly what you were saying, things are interconnected. It's not just one thing, it's other things that are impacting, and to have someone there that you can trust and talk to and work through it. Oh, I love that. No, that's awesome.
Yeah.
Okay, so one of the things that I'm curious about is, how does pelvic floor therapy help with postpartum recovering and healing after a vaginal birth or a C-section? What's the difference?
Yeah. So people have this, like, people will sometimes say to me, oh, I didn't have a vaginal delivery, so my pelvic floor is fine. And it's not necessarily the case. It can be the case, but pregnancy in and of itself is a lot on the pelvic floor, and it depends how you carry. So some women carry high and their pelvic floor is kind of untouched, you could say. I mean, we don't really know, and then some women carry really low. And so they feel a lot of pressure down below during their pregnancy. And so you have to kind of peel back the layers and listen to what they're telling you about how their pregnancy went. And then, yes, the delivery mode can be different. And so a vaginal delivery, the pelvic floor muscles have to stretch 4 times their regular length.
Oh, wow. It's 4 times. I mean, I guess it makes sense, but 4 times?
Yeah.
Wow.
Yeah. So, and you have a lot of nerves in the pelvic floor. And so there can be a lot of stretching to these structures. Some women recover quickly and some women don't. So there are things that can happen, but it's not like it's not like, oh, well, too bad. Too bad, so sad. There's so many things we can do to rehabilitate the pelvic floor so that you can function well.
That's awesome.
And then with the C-section, that's a whole nother thing. It's a different approach. I had a C-section for my twins. And when I had my C-section, they kind of just like sent me back to my room, but they kept me on a reclined bed, right?
Okay.
And they kept me there the whole time. Like I was like in a reclined position the entire time. And now there's research coming out that like there are benefits to women lying flat after they've had a C-section because our abdominal muscles need to be at a certain length to help function well, right?
And laying down stretches them out and they're more compact when you're sitting up. I didn't even think about that.
Yeah. And so now I have like to this day, if I cough or sneeze, I get like a little sharp pain sometimes in my stomach. And I can also get like little cramps in my lower ribs. I understand it, right? So I know what to do for it. I know I need to stretch. I know I need to work on these things, but it affects your posture. It affects everything. Yeah. And so being able to get in there, like now there are more women being seen by pelvic health therapists in the hospital postpartum.
Oh, really?
Yes, but it's still only a few hospitals, but it's slowly expanding. And so little things like that are so important, let's allow your scar to heal in a neutral position, not in a shortened position.
Yeah. I never thought about that because I've had 3.
Yeah. So things like that. And then some women after they've given birth have more of a separation in their abdominal muscles, which is totally normal. It's called a diastasis. It's completely normal. Everyone pretty much has it while they're pregnant. It's how the abdominal muscles.
There's only so much space, right?
Yeah, exactly. There's only so much space. But everyone has different connective tissue. So some people are loosey-goosey by nature and they're just like super flexible and bendy. And other people are tighter and and that's just your makeup and there's nothing you can really do about that, but it affects your recovery. So some women, their abs just kind of close back up and they go on. And other women come in, 4 or 5 months postpartum and they're just so depressed because every time they go out, someone asks them, oh, what do you do?
Oh, no. Oh,
because their belly is distending out and it looks like they're still pregnant. And it's just that their abdominal wall isn't able to contain the structures, so it protrudes out.
So no one wants to hear that. No one wants to hear it.
No, that's like the worst thing you can hear.
Yes, it is.
So, working with these women and getting them to recover from that and strengthening up their abdominal muscles and shortening the tissues and helping the tissues move back into a supportive position so that they can feel stronger. It can change their aesthetics if that's what their goal is, and it's just giving them a lot of tools to empower them. And then when you're pregnant, also the other thing is that the baby gets shoved up into your lungs, right? So I don't know about you, but when I was pregnant, I had this
you had 2 in there, so I can't even.
I had this horrible rib pain. I would just like walk around with my hand like on my rib cage at all times. And it was because the babies were like pushed up in there. And so my ribs were flared open. And for some women, they never they never realize that. And so
Yeah.
their abs won't turn back on because their ribs are in a position that's not optimal.
Interesting.
So you've
Yeah.
got to work on getting their mobility better, getting them moving a little bit better, getting them breathing better. And then they'll say to me like, oh my gosh, I feel my abs. And it's like, yes. And these women, a lot of these women have gone on Instagram and they've watched these like, get your core back after you've had a baby.
Oh.
And they'll try
But
it
it's
on their
not
own.
going to do anything, right? If your ribs aren't in alignment, which
Right.
we're trying to do it all ourselves. But I think the biggest thing I have learned from interviewing so many women at this point is like, go to the person who specializes in this because
Yes.
they can really put you on the right track. Yes, there's so many resources and yes, but all of our bodies are so different. And we go through, like, even with each pregnancy, our bodies experience different things. So
Yes.
seeing someone who specializes in that can really help you. And I feel like the internet can be scary when you start like really
Totally.
Googling things. So that's why I love this because I want people to hear about all these amazing people who can help you. I want to close with what I've been calling the real life rescue kit. So it's 3 quick Minnesota specific recommendations. So the first one is, what's your go-to takeout spot for dinner? And what do you usually order from there?
So it's very much because of my kids. And
Yeah,
I have
always.
a neurodivergent kid who's a very picky eater. And so he loves punch pizza. Thank goodness. I like punch pizza as well.
Yeah.
So we go there and I try a new pizza or a salad and I'm super happy. And my kids are super happy to eat there. So that's our go-to spot.
It makes a difference when they're not complaining. I feel like you just know, and that's where you go because everyone is happy, and then yes, it
quiet
makes
at
it
the table.
easy. Yeah.
Yes.
Yes, because
Yes.
they're eating and not
Yes.
complaining. It is true.
Yes.
Okay, the next one is, what's a kid-friendly outing in Minnesota that you actually think is worth the effort and it's genuinely enjoyable?
Well, it's also because my kids are ADHD, we live at the Sky Zone on the weekends. We go there. They love it. They just have a ball. And so I bring my computer and I sit in the corner and I do work and I'm happy. They're happy. And then we come home and I feel like our house is like just, a little bit calmer because they got all that energy out. Especially in the winter. Now that it's getting to be nicer, we can go outside. But in the winter, I feel like Sky Zone is like saved my sanity.
100%. 100%. We love it at our house too. I feel like it hits every age. Maybe not my 16-year-old anymore, but really
Sure.
the 14 and the 7-year-old. It's amazing. Okay. And the last one is, what's your local resource for moms? Where do you usually turn?
So I am new to Minnesota and my kids are 10. So I feel like now I'm on Facebook probably the most and looking for activities on the weekend, looking for any kind of festival or like we went to this cool kite show on the ice on a lake.
That one is cool.
Yeah, I don't even know where we were. I just follow my GPS. And, it just gives us like an outing and something fun to do. And I would have never known about that had I not seen it on Facebook. So for me right now, I'm constantly looking for things on Facebook.
The local mom groups, I mean, I find them to be very helpful when you search in there. They always have the best recommendations on things to do, and even certain contractors, plumbers, like that's the first place I go when I need someone to do something at home. I right away turn to my local mom group and search it in there because it's like the trust factor, right? You're like other moms and they all weigh in. I love it. Okay.
I love it too.
Thank you. Thank you. Thank you, Sarah, for taking the time to talk to us about pelvic floor health and what you do. I know people will find this super interesting and they'll be able to take a lot of nuggets away from it. If someone wants to reach out to you, what's the best way for them to do it?
I would say go to my website. It's www.Sakura Pelvic Health, and Sakura is spelled Sakura. It means cherry blossom in Japanese. And they can go to my website and there's a contact us page, and then we can set up a 15-minute consult, and then we can kind of chat about what they're experiencing and go from there.
Perfect.
And then I'm
And I'll make
also
sure
on
I link it.
Instagram, and I'm
Okay.
also on Facebook. So,
Perfect. I will link your website and I'll link your Instagram, and we'll make sure that people can reach out and they know where to go. Well,
okay.
thank you
Thank you.
so much. Thank you.
Good luck. You're doing great. Keep it up.
Thanks for listening. And now for my quick disclaimer, the part I have to say out loud. This interview is for educational and informational purposes only and isn't medical advice. For guidance that fits you, talk with your healthcare provider. Thanks for listening to Made for Minnesota Moms, and I can't wait for the next interview.